coming out of fellowship, the way you practiced or the practice you were at, very different than
Correct.
where we are right now. What were those first 5-10 years of practice like before you met Bill Wiley, before you came to the Cleveland Eye Clinic?
Yeah. So, I mean, it was a style of practice where it was more of a comprehensive surgeon. I was in a multi-specialty group, not just multi-specialty in terms of ophthalmology, but a group of maybe 100 doctors that included family practice, neurosurgery. There were 3 ophthalmologists in the group, and all of us were comprehensive surgeons. So we would go ahead and treat all aspects of care. In the community there was no real glaucoma surgeon you basically did everything per se. So I would go ahead and do that. And then I would one day a month go ahead and do refractive surgery as well. Now, when I did refractive surgery, I did all the pre-ops, determined the refraction. I had a roll-on, roll-off laser that would come in. We'd go and do our procedures, and then I would take care of the patients post-operatively. And it was style practice. That's all I saw, all I knew. I did not know that there was other aspects out there. It's just by chance that about in my 9th year or 10th year out there, the whole system was being bought out by a hospital-based system. And all of the doctors, the model was compensation was being changed to more of a employee-based model, as opposed to before it was more of a productivity-based model. So we're all going to become salaried employees. And I was still relatively young where I felt like I did not see myself in my long-term career of being in that type of environment. I wanted to do something more inside there. So that's when I started looking at other opportunities. And it was interesting because prior to that happening, my mind thought that this was going to be my final place where I was going to retire. I mean, I actually had went ahead and built this dream house. We had like 8,000 square feet. Beautiful. I had imported marble in from India and just made it very customized, stuff like that, because this is where I thought was going to be a final thing. The funny part is that's the house that I probably spent the least amount of time in than any other place I've been at. But we went ahead and I started looking for different things, and just by chance came across Bill. I actually talked to one of my phaco reps, and my phaco rep said, hey, you may want to consider talking to this person. And Bill, I guess, had been looking for someone for almost like maybe 3-4 years and did not want someone fresh out of school, but someone that had decent experience, decent hands, things of that nature. And the challenge, I think, always is that if someone is pretty good at what they're doing, they're probably not looking for a job. They're probably going ahead and doing what they want to do. So just by chance, I came across meeting Bill at that time, and things completely changed at that point in time.